A team physician is typically a sports medicine trained orthopedic surgeon or primary care physician. And typically what that entails is they will do their usual training. For me, it was 5 years of orthopedic surgery residency, and I did an extra year of subspecialty training in sports medicine so that I can take care of a team. Typically, the teams that I take care of are high school teams and college teams. Sometimes we cover some professional sporting events and any events that come into the city. In that role as a team physician, we take care of injuries, both on the sidelines as well as occasionally have to take those injuries to surgery, such as like an ACL tear. So it's many different arenas that I'm covering. So sidelines, athletic training room, in the office, in the operating room, and also sometimes on the field. So day to day, as a team physician, I would say I would usually get 1 to 2 texts a day from the athletic trainers that I work with. An athletic trainer is a person that works with the athletes, and they're more, in the trenches with the athletes, so to speak. They're with them in practices and games.
We help injured athletes get back on the field faster, and we also help prevent injuries. I also act as the liaison between a lot of our medical staff and our coaches and our strength coaches to kind of help mediate injuries and get athletes back on the field faster.
An athletic trainer is a person that has usually a bachelor's or a master's degree. The majority, about 70% of them, have a master's degree in athletic training, and that means they are specifically trained to take care of athletes. And their role is a little different from mine, where they're with the athletes on a daily basis, typically all of their practices, all of the games, and then outside of practices, just doing things like icing after practice. You'll see the players, in the bathtub, in the ice baths or the hot baths. And I work with the athletic trainers very closely. So if a player, has an injury and they need to be evaluated, I'll go to the athletic training room, and the athletic trainer will tell me what they think their diagnosis is and how they're treating it, and we kind of come up with solutions for player injuries together. The athletic trainers and I are constantly texting back and forth about any player injuries that may be occurring, and anytime I need to go evaluate them, I'll sometimes come to the court. I'll evaluate them in the training room. Occasionally, there are on-field circumstances that need a team physician. If you watch, the NFL, you'll see team physicians run out on the field to take care of athletes. That's typically an athletic trainer and a team physician.
I think it's important for all schools, high schools, colleges, to have athletic trainers because it helps mediate any high-risk injuries. They're there to help prevent any catastrophic injuries, whether it's somebody who goes down with an ACL tear or something more serious. We're kind of trained in all different types of emergency care to kind of help decide what level of care they need and then where we need to transport them to.
Athletic trainers are really essential. They're really important both in the college arena as well as in the high school arena. We even have some athletic trainers that are covering middle schools. We're fortunate enough in some areas of St. Louis to have athletic trainers at middle schools. Our goal would be to get an athletic trainer in every single high school because we know the importance of having athletic trainers for athletic injuries, and just not only musculoskeletal injuries but also head injuries such as concussions. Athletic trainers are specifically trained to manage concussions, to diagnose concussions, and to make sure a player can return to play safely.